proud that you're the first alumnus, I would say, that certainly the first honorary fellow who becomes Director General of WHO. Of course, also the first African, and all this is music to our ears. And before diving into WHO matters, maybe you spend a year here and a master course. So, any specific memories or anecdotes that you share with us, or how did you live that year? It's quite a while ago, but still. And when you entered the building, you were, of course, here 2 years ago? 91. Yes. And then 2 years ago when you became 2012, yes, Honorary Fellow. Yeah. So how was your time here?
Oh, my time here.
You don't have to tell us everything.
No, first of all, thank you so much. Very glad to be back home. I consider London School as my professional home, actually, where I started my professional career in a serious way. I did Immunology of Infectious Diseases. We were the first batch, by the way, so we were like the lab.
The guinea pigs.
The guinea pigs, yes. And it was the first time, and still the school also learning on putting together that new course. So it was a very good time, actually, both for the staff and also for the students. And maybe one general thing I remember is it's almost the same. This is a very small space, but the whole world converges here. Not only the master's training, but you can see yourself as part of this big global community. And that feels so special, used to feel so special to me. And even I started asking people who come from all corners of the world what thank you is in their language. And then the Chinese, shishie.
Yeah.
And Japanese, arigato. And, you name it, takshkaduhe, and so on. So, you see the beauty of our world here. And we come from the different corners of the world. We look different, the way we look, maybe the phenotypic. But you also get convinced that our aspirations are the same. Everybody. Aspirations are the same. And that's what you see. And that's when I learned the power of this school, bringing almost a very small space, the whole world almost converges here. I have met many people from all corners of the world, starting from my own continent and the rest. And it was really a great experience. So not just the professional development, but your view of the world also changes. Even more important, by the way. So that's one. And for me, of course, coming to a big city like London was first time again. And knowing how to live here was tough. And especially the first 2-3 months is very stressful. Lots of materials to read and study, and a lot of stress. Of course, after you pass that 2 or 3 months, what do you call it? Then you're okay. You started to stabilize. But the first 2 months was tough in an environment. Yeah, in an environment where you're new and all the stress. So that's also what I remember. But I really, I'm happy that I had the opportunity to study in this school. It really changed me tremendously. Not only my professional career development, but also in a way my views the world also. So thank you so much to my school, and glad to come back to meet my family here. So
thank you. No, I remember when you gave your address to our students that you said it's also the United Nations are inside one building.
Yes.
Everybody. Now, one of the reasons that you were brilliantly elected as Director General of WHO was your performance as Minister of Health in Ethiopia. What are you particularly proud of, what you did there? Because, of course, we've written about it, we've done evaluations and so on, but what do you personally you feel that's really where you made a difference there?
First of all, something that I didn't like during the election was, I was forced to say I. Because people were saying to me, when I say we did this, we did that, they used to say, no, people will not take you seriously if you don't say, I did this, I did this. They will not see they will not see your energy and so on. I didn't like it, and it took me a while until I started to say I. It's still difficult, it doesn't feel good. But one thing that made a difference for me is, as a team we were successful. Starting from the political commitment of the government, but at the same time in the health sector, building a team that's really aligned by a common vision. And that was really key. We knew what we wanted to achieve, and we knew how to achieve those. And we didn't settle for small goals, but big goals, ambitious goals. And from the start, we said, we want to achieve this. This is what we, can make a difference, and that we need to own it. So the ownership issue is also very important. And we were operating exactly that way. So if you have these elements, a strong political commitment, and a clear goal, ambitious one, and also the strategies on how to really achieve those goals. And then if you can mobilize all partners, especially communities being at the center, and then if there is country ownership to that, and if partners could really support you based on your priorities, I think that could be change. And that's how we did it in Ethiopia. And I'm just part of a team, and of course it's a good result. And that's why it made sense to many people to vote for me, saying, okay, we participated in a country where good progress has been made, so we can also make a difference globally. So I think that's in general, maybe without going into details of what we did. But on the outcome, underprimal mortality declined significantly, maternal mortality declined significantly, malaria, HIV, TB, the MDGs, I think very good progress in all fronts. And the reform we did was also very comprehensive. It covered almost all building blocks of the health system. Workforce service delivery, health information, health financing, governance, access to medicine, the revolving drug fund, and emergency response CDC type model. So it was very comprehensive, and that's I think another important experience that may also help me in WHO, a comprehensive reform, to see health in its entirety as a system, but also to see the parts also. Normally we try to see things in silos and parts. The comprehensive approach is important because you see the system and you see the parts. That's also the other experience probably that helped me. But not only as Minister of Health, but the other advantage I had was my service as Foreign Minister.
Right.
And what I can bring from the from diplomacy. As you know, WHO is very shy, and it only works with health ministers. But WHO should have both technical and political leadership. And it shouldn't be shy in approaching foreign ministers, finance ministers, heads of states and heads of government. And WHO should take advocacy as its own responsibility also. So both technical and political leadership is really key. And they saw that I can bring that experience to the table, because ministers of health need support from WHO. And WHO should not only engage in efforts, but to support health ministers should also work with the other important sectors. And with SDGs, that's a must, because SDGs calls for a comprehensive approach, putting health at the center, health for all, and all for health, or health in all policies. So it's a must to have relationship with all the relevant sectors in order to achieve the health goals. And all the other goals, by the way, affect health. Our trade policies, even security affects health, industrialization affects health, and other issues in the SDGs affect health. So seeing it so that is important. And probably I can bring something to the table also in that respect, so combination of the two.
Yeah, definitely. And you had a stellar start because you're coming straight from the G20. It's the first time that the WHO Director General actually participate in the G20 meeting and addresses the heads of state. Up to now, it was only with the ministers of health who meet on the margin. So, how was it? I mean,
yeah. First of all, I think I would like to thank Chancellor Merkel for her leadership. This is the first time that WHO was invited to G20 summit. And not only that, I hope you have seen the communique. It covers the most important issues: universal health coverage, strong health systems, emergency response, antimicrobial resistance. These are very important. And not only that, they have also agreed to build the capacity of WHO. So, two things here. Not only that WHO participated for the first time, but what was agreed was also really, very, very good. And this will help us, not just WHO, but the international community, especially the health sector, to benefit from this high-level commitment. So I'm really grateful to Chancellor Merkel. And during the intervention, many of the leaders have already expressed their support to all the agenda items, all the issues I just have raised. And this is a very good opportunity. Now the issue is, how do we exploit it? How do we exploit this? How do we make use of this really political will to achieve our objectives? And in order to do that, WHO alone will not be able to do this. We have to work with all our partners. London School of Hygiene being one of them, and try to work together in order to achieve the big objectives, health objectives we have, global objectives, but by using the opportunity that's open now. I have already spoken with Argentina, which will be the next president of the G20. They're willing to also include WHO. But if we can use the opportunity that's already opened up, and then try to understand how we can use the next, just it should not be attendance for the sake of attendance, but how do we make use of the next opportunity will be very important. So G20 was really good, but we have the question now is, how do we make use of the opportunity that's open? And we will need your support in making sure that WHO is one capacity, but we have lots of capacities globally, and we need to map them and make sure that all these capacities can really open up new opportunities with regard to achieving our global health.
No, that's terrific. Of course, on climate change, there's one country, the US, that is not believing in it. So that was the good news is that the rest of that 19 countries strongly supported it. So that's good news. But I think also this G20 marks the fact that Germany is becoming really the leader, I think, in global health today, and that's a new trend. And that's for us is also important. I mean, as a school, to make sure we are supporting that. But secondly, for WHO to play this kind of a role on the political level will require some cultural change and some change. You're there as the leader, but the organization is not really always fit for that. Now. You told me that one of the G20 leaders said that you have the most difficult job in the world, and that's probably one of the most difficult ones, absolutely. How do you start? You're fantastic, you have election, and it's, you must be totally exhausted after an election campaign, and then how do you start? How do you get... you're entering there, you have an empty office, a big office in Geneva, wonderful view of the Mont Blanc. But then how do you take this on?
How do you start?
Well, and what are you doing? What is the transition that you're in now?
When I start with a belief. I believe in us. All of us. If we can work together, I think we can make a difference.
Yeah.
So believe that I am not alone. Believe that WHO is not alone. Believe that this is not an issue of a few organizations or a few people. It belongs to all of us. And when I start with that belief. I believe in us, and if we work together, we can make a difference. Then I followed actually the first few days, even during transition. The transition was short, by the way, because the election process was very easy. It's the first time that all 194 countries were involved in the selection. It was like one vote, one country, and that process was very long, and the transition was short, just 4 weeks. But based on the principle I told you, what I did was I started from listening to the staff, departments, directors, the ADGs, and people in the regions, and also in our country offices, to send me recommendations, any crazy ideas they have for that matter. If we have time, I would be happy actually to ask you also to send me any or to tell me now, while I'm here, some recommendations you have, any crazy ideas you have. So,
a bit later.
Yeah. So, I was so happy by the level of engagement actually since I asked for recommendations from them. For any change to happen, I think the emphasis should be given to internal. Unless we change internally, we cannot really use the opportunity, the external opportunity that we have. And when you say internal, unless the change agenda is owned by the staff itself, no change can come. People cannot be pushed or instructed to do things. They should believe in it, and they should be persuaded. It may take long, but that's the most important element of any change process. But we fail to see the human face or the human side of change, the most important thing. And when I started this, it was because of this strong belief that I have. Each and every individual in the WHO can contribute to new ideas because they understand the challenges and they know the root cause of the challenges and they know the solutions also. So that's very important, and their participation from the very beginning will make sure that they're part of the process and they start to order. And then whatever we implement to change things for good, I think they will also participate and they will be willing to change it. So that's very important, and that's how I started. And then we asked them, the ADGs, to put together some directors to work on the recommendations that came from the whole organization, starting from the front line, the country offices, through the regions, through the headquarters. And they're trying to analyze the recommendations. And from those, they will select the top 10 important issues that can bring a shift in WHO. Then that will be seen in line with my vision statement. The 5 priorities I have already identified or outlined during my campaign. And from there, we will identify a combination of the two. We will identify the priority areas to help us focus in select issues or high impact issues. And in addition to discussing with staff, we're also discussing with partners. We have already met as many partners as possible, and they're giving us their recommendations, their crazy ideas, and we're taking that into consideration also. Then after we're ready, after identifying these high impact issues or priorities, the next move will be again to believe in partnership, both internal and external, and move into implementation of what we have identified together. So when I say partners, it will be member states, it will be academic institutions, it will be societies, NGOs, the private sector, and all of them. Then I have already started talking to them also. I came from Wellcome Trust, by the way. When we say partnership, it should be effective partnership. Partnership for a cause. And we have to start from mapping all the capacities we have, as I said earlier, and then have partnerships based on goals, objectives, and then to share the activities to achieve the goals based on our comparative advantage, and to have a mechanism of measurement to measure our progress too. So when I talk about partnership, it should be based on clear expectations. It should not be just partnership for the sake of partnership. So I think through the internal process, I say, and building effective partnerships, it will be really possible to achieve the ambitious goals that we're setting for ourselves. So look forward to working with London School very, very closely. It's not because it's my school, it's because it has a great potential. Huge that WHO hasn't exploited. Don't take the exploitation negative. But I know the power you have, and I know the capacity you have. And when we map the capacities, I think London School will be one of the tallest, and look forward to working with them. Thank you.
Well, thank you very much. No, and you have a clear vision. I mean, you were elected on a vision and with a priority, so that I think we can fully support. But what you're saying about partnerships is music to my ears, and if you connect that with the what you said before about having the whole of WHO on board, I think that's where that's going to require quite some effort, because WHO in the past has often claimed to do it all by itself, always claiming we do it, claim the space, and that not being able to fill it. And I think that just as we cannot fulfill our mission without a partnership, that is really a fantastic approach. And that's the reality also of this world. Of your priorities, like universal health coverage is like, I'm not saying number one, but it's really a very overarching one. Now, how can you, and that depends on countries. What I liked what you said before is also that a global organization is only as effective as what it happens in every single country. how can you as WHO promote that? Have you some path to achieve that? Even if some of the high-income countries, starting with the US, doesn't even ever reach it and seems to go backwards. So how do you, can WHO help to do that?
Yeah. When I said earlier, WHO should lead both technically and politically. One of the political issues is universal health coverage. Then WHO should advocate really taking health as a rights issue, an end in itself. Plus, it's also a means to development. It's healthy society that can also bring prosperity. So I think WHO should really advocate. Many countries consider expenditure on health as a waste. It's not a waste. It has actually, it's actually a means to development if we invest in health. But a combination of the two, I think, can bring clarity. It's a rights issue in the first place, an end in itself, but at the same time, it's a means to development. And we have to advocate. That's why partnership is important on this. You know, you can mobilize the academy, mobilize faith-based organizations, civil society, NGOs, to really convince countries to take this as a basic principle, health as a rights issue. That's key. And the second is, there are best practices globally. Countries who are poor who have implemented universal health coverage.
Right.
Countries in the middle who did. Countries very wealthy who did. You have examples from all categories of countries by economic development. So we should benchmark those and share it with countries. And those countries who share this, of course we should do this proactively, who share these practices can tailor them to their needs. WHO and its partners can help them in tailoring this experience to their needs. And then, not only that, we should help countries to implement UHC based on what they have tailored to themselves. And we should go even up to mobilizing resources for those who need support in terms of resources, because, from one country to the other country, the situation will be different in terms of need for resources. And I still am a strong believer that whatever comes from outside is a complement. If there is political commitment, the domestic resources are actually a big part, and actually the biggest part of whatever we will invest in UHC. This is how I think should be implemented. But one important question is, do we really know UHC? I think we should start from there. What does it mean by UHC? And we talk about strengthening the health system to achieve UHC. What do we mean by health system strengthening? What does it cover? Then for both, what indicators do we have? Be it financial protection, access to drugs, or other indicators. And how do we measure these indicators? And how do we know whether we have achieved the UHC or reached our destination or not? That's where actually London School and others are really needed to articulate this, to have a clarity of what it means and what it takes, and also measurable indicators to measure progress, and based on that to make everybody involved accountable also. So this is just a frame, but we can articulate it more together. But UHC surely will be the center of gravity for me, where I would like to focus my energy and resources, because UHC means, as you rightly say, it really covers almost all the things we identify in fragments.
Yeah, and that's, I think, indeed where we can, work together. Now, you're here also to address the big family planning summit tomorrow. Mm-hmm. And what is going to be your message there? Because it's also an area that's close to our heart. It's very important, and it's as much political as technical. Because at this very moment, there is a technical meeting going on, event to prepare for the summit that's organized by the school, but with partners also. But tomorrow, I think it's important that as Director General, it's fantastic that you're coming to express your both solidarity and also commitment.
Yeah, maybe two messages there. One, sexual and reproductive health rights was an issue. I think it's very important, and that's one. Women should have the right when to have a baby, with whom to have a baby, and how many, and So it's a rights issue again. It's political, by the way. And then the second is family planning brings social transformation. That's second message. Maybe I will explain this one. If you have family planning, successful family planning, there will be spacing of children, means less children. And then the mother will have time to be involved in economic activities. So less children, but more income, because the mother has time to be involved in economic sectors, activity. Then more income, less family means better quality of life at the family level. It's quality families actually that build the nation. And then there is another side to it also, another story. When a woman starts to earn, brings what? Economic empowerment. And from economic empowerment, what's next? It's political empowerment, starting from the family again. You know, political empowerment, you know it, starts at home. With that. So that actually brings social transformation. So family planning, it's just not about having less children and not. You know, it has like a domino effect of, triggers other benefits to, not only to the woman and the family, but to the whole society. So I think we should that way. And this benefits the nation actually for those who want to develop their nation. I think they have to see it that way. That would be my message. We should not be think family planning is like taking pills or Depo-Provera, so let's do that. It has more meaning than that.
Yeah, indeed. And also preserve our planet.
So these are the two messages.
Yeah. Yes. Well, there's some time for questions and for the crazy ideas that Dr. Tedros said. Yeah. So, Andy? Can you introduce yourself, not for the other, for Dr. Tedros?
No, Andy.
I'm sorry.
Andy, and I can see Hazel also, Hazel Doctor. My mentors here. I'm glad to meet you here.
Well, congratulations again, Tedros. I wanted to just ask you a bit more about this challenge to delivering the integrated vision that you've outlined through the SDGs, through universal health coverage, and through addressing some of these big environmental issues. And there are, I think, internal and external challenges. Internally, WHO is not always very well configured to address them because there's a disconnect between some of the disease-specific programs, those that deal with specific age groups, and more cross-cutting programs like health systems or environment. And I wonder if some of the reforms that you're thinking of putting in place will address some of these disconnects within WHO. And I think also externally, there are other challenges in terms of WHO's role in the UN system. In order to ensure that health is at the centre of the SDGs, WHO needs to play an important role across the UN system and with the World Bank and so on. And I just wonder what your vision is for achieving that important coordinating and catalytic role externally.
Thank you. Let's have a few questions and then we can... Yes, please.
Thank you. My name is Tedros.
Is it on?
My name is Mihrat. I'm from Ethiopia. I'm really happy to see an Ethiopian leader who changed the health system of my country as WHO DG. Well done, and thank you for well representing Ethiopia and Africa as a whole. My question is, from your professional experience, what's your advice for young public health professionals, specifically coming from low-income country, to be well represented in the global public health sector? Thanks.
Okay, and then we have the result, and yeah, so we'll take 4. Can you give?
I have a question and a crazy idea, so maybe the two are the same. But Director General, it's really wonderful that we're all recognizing the fact that it's the first in terms of African leadership in WHO, and for this time for Africa, I suppose, to help lead the way in global health. And I suppose the question that I'm interested in is you talked about African inclusion before, but can you share more about why you think that's so important?
What inclusion? What?
Why is African leadership now so important for WHO going forward? And then, if I may, the crazy question is about can we use artificial intelligence at some point to try and tackle the problem of chronic long-term?
Okay, good, thank you. Joy.
Thanks so much, Joy, Lorne, and I'm an African, just collected the wrong colour of skin at birth, so I think we're really delighted to see an African in this position. And so my question to you, I hope it's not a crazy question, but what do you think needs to change for particularly WHO's African regional office and leadership within Africa? Because what you're talking about in partnership is so powerful, but it's really underachieving at the moment in Africa and could have real scope for change. Thank you.
Okay, I'll throw them 2 more, and then, okay, so, yes, mics. Okay, you have the mic, and then
it's the same question.
Same question. Great, thank you for your general.
My name is Kimal Holland, and I work in child health. We've met in the past. My question relates to...
Married to Ethiopia.
My wife is listening online, actually.
Oh, okay.
My question is really about the issue of universal health coverage and equity or inequity in child health and inequity in health in general. The review of the Millennium Development Goals that was conducted by the London International Development Centre highlighted failure to pay attention to equity as a major problem with the MDGs. And I think in many countries that I'm involved in, there has been a worsening of the gap between those who are covered and those who are not. The universal health coverage looks to me like an approach to try to cover everybody, but an alternative approach is to try to identify the highest risk groups and target the interventions much more closely to those. I just wonder what your views are about them.
Easy questions. Then yes, please.
Hello, Dr. Tedros. It's really an honor to have you here. My name is Ngozi Irandu, and I'm an assistant professor here. On Wednesday, Professor David Heyman, he's hosting an expert meeting on post-Ebola solutions for low-income countries, looking at how to invest in the health system. And one thing that he pulls out is something that you said about this misunderstanding or this disconnect between looking at the curative services and public health functions of the system. And he talks specifically about the international health regulations versus the WHO health systems framework and how they really do not talk about each other. And so what message do you have to harmonize these two frameworks and these two objectives in order to guide investing for stronger health systems to protect global health security? Thanks.
Okay, and then the last one, yes, please.
Hello, I'm Julia Montaña. I'm doing my MSc here. I'm also co-author of a letter in the Lancet, as it was like the letter that you answered on the elderly women during your election campaign, and we're very grateful for that. I'm also very grateful that your vision includes that we show living in a technical and in a political manner. It is a sad reality that the current incentives for research and development don't meet many people's health needs either because of access to medicines or because there's little market incentive to create medicines for the poor. And my question was, what is your vision to ensure that the WHO is on the driver's seat in the prioritization and coordination of R&D to meet people's health needs? And do you think that the Global R&D Convention, as has recently been suggested and recommended by the UN High-Level Plan on Access to Medicines, to create new needs-driven incentives to R&D such as prices, would ensure that the WHO can drive this agenda forward and ensure that health needs are met with it? Thank you.
Thank you very much. So we have a few minutes, and to see whatever
Yeah.
5 minutes. Yeah.
5 minutes. Okay.
At the most.
To be selective.
Yeah.
Okay.
No, all
No,
great
these
questions and comments. So
I would have loved if I got your crazy ideas. I don't know why. I know you know a lot, and you could have packaged them in a recommendation. Hopefully next time.
Yeah, and there's always your email. You can send it to. What is it? Director General.
Email, yeah. DG office at WHO. DG office at WHO.int.
Maybe Twitter to keep them to 100.
Yeah. So please send us. On the disconnect, it's true. And when we discussed with the staff, actually, the discussion we have started, what we're saying is we have to see the system and we have to see the parts. And then how the system, the whole system operates, and how the parts within the system affect each other. Because when I met with the directors, as he rightly said, people are busy in their own silos, fragments. And even one director expressed it as thick wall, thick, very thick. So they don't communicate horizontally. And that's dangerous for an organization because one, you lose two things. One, by working together you can create synergy, you lose that. And two, what you do affects the other one. So you might affect the other one in a very negative way. So undermines overall progress of the organization. And I think that has to be really addressed. We have to see what it takes, as I said, to achieve UHC, and what are the components of it, because almost all of them will be components of the UHC. And how do we address the vertical disease-specific programs within that UHC approach? And one of the reform for WHO, which I have already discussed with staff, is actually that, to break the silos. You know, people, when they identify some of the challenges WHO is facing, they talk normally about the disconnect between the headquarters, the region, and country offices. But more important is the disconnect at the headquarters level between departments. Without addressing that, we cannot talk to regions to really line up or align with or harmonize their efforts, because we're not harmonized even at the headquarters level. When we're even sitting next to each other, we don't talk to each other. We don't work together. So that's the most important challenge, and I agree with you. And I will take it as a recommendation, reinforcing what we're trying to do. So we'll see both the horizontal relationship and also the vertical. We need to really re-engineer the processes, make them lean and mean, and this should give us systems. Even the structure we're going to have will really focus on the content, the strategy, the processes, new processes, and then the structure comes to really help achieving the goals using these processes. Then within the UN system coordination, when I was still DG elect during transition, I had a chance to travel to New York to meet my new boss, Antonio Guterres. He has the same opinion. WHO is a convener, a coordination role. Of course, Peter was saying WHO should not compete with others because it's actually a convener and should use the capacity of other partners. And the Secretary General also understands it that way. And he told me we should avoid any duplication or parallel and have this coordinated role. Coordination role should be WHO's, and WHO should be firm on this.